So today's topic is overdose prevention and community outreach, and we have some really great content for you. Okay. So Bridge is a program of the Public Health Institute, the Bridge Center, which receives support from California Department of Healthcare Services. So just throwing that out there. All of our information is available on our website and is free to use. I kind of went over this already, but again, utilize the chat to engage with us. We love when you engage with us, and closed captions are available. So as a reminder, CA Bridge is we're statewide, and we've advanced we continue to advance, but we started off with a goal of 24/7 access to substance use navigation and addiction treatment in every hospital in California. And we reached quite a bit of that goal. We reached 276 hospitals out of 330, I think. So we think that we did pretty amazing, and our work is not done. We're continuing to expand the work that we've all started and that many of you are a part of. So thank you. Our Saybridge model is really, shaking up and mixing up the previous standard of care, the previous system. So we're revolutionizing the system of care through our three pillars, which are low barrier treatment, connection to care and community, and creating a culture of harm reduction. And now for our announcements. We have Navigator Update coming up in September. It's on September 10th, every Wednesday. It's a really great opportunity for navigators specifically to attend and engage with Seabridge, other navigators, with mentors, to network, learn new information, and really share ideas and resources. So highly encouraged to attend. 30 minutes the second Wednesday of every month. We also have our Navigator Focus series, which is usually every month as well. Today you're attending the one for August, and our next one is in September, which is on the 25th, and it is always at 11 a.m. Next month's topic will be expelling MAP myths. And our Navigator peer support, which is specifically requested by the navigators in order to create a space where you can connect to each other in a different way, and kind of be able to find that balance of self-care and things like that. So we invite you to attend this safe and supportive environment. And the next one is going to be Wednesday, August 27th at 3 p.m. And as a final announcement reminder, we have our Sea Bridge Regional Collaboratives. These collaboratives really provide an opportunity for all sorts of people in every community to join together for the purpose of, expanding low barrier MAT. We highly encourage ED programs, community-based clinics, navigators, treatment facilities, harm reduction services, and all other services in the community that the people who are seeking resources can benefit from. Our virtual regional collaborative is open to everyone statewide, and it is free. So register and join us. And we have some in-person ones coming up later in the year. So check out our website, and you can always contact us for questions using mentors@cabridge.org email. Today's objectives, you will be able to demonstrate overdose prevention strategies to educate individuals and communities in recognizing and responding to overdoses. You'll be able to verbalize knowledge of naloxone administration for home emergency use and community training. And then identify community resources to expand harm reduction efforts. So I'm going to silence myself and introduce Celia Sanchez to share with you a mother's perspective of her lived experience. Celia?
Good morning, everybody. Thank you for letting me share. My name is Celia Sanchez. I have been a healthcare worker in a major trauma center hospital for more than 33 years. I am also the mother of a child who lost his life to a fentanyl overdose. My son's name was Garrett. He was more than somebody with substance use disorder. We lived down the street from his high school, just a 5-minute walk, but I would drive him there every day. That short ride was our time together. We would share music. He would tell me about girls, about his upcoming tournaments. My husband used to say, I don't understand why you drive him. You could walk there. But that was our time. That's when we connected. And I miss that more than words can express. But I'm here today not only to share my pain, I'm here to help other families who are either experiencing a devastating loss like mine or walking the difficult journey of addiction with their loved ones. Garrett had big dreams. He was handsome, funny, outgoing. He had so many friends. He was a gifted soccer player. He had dreams of playing college soccer, becoming a nurse. He really had a heart for helping people. He had an amazing sense of humor. He had a deep love and a deep knowledge of music. I would always call him an old soul. We lived a pretty normal life. Garrett lived mainly with me and my husband, Robert, though he also spent time with his dad on the weekends. But no matter what, we were a family. We would cheer him on at soccer games, tournaments, school events, all of us together. But during his senior year, I saw things begin to change. He became irritable, volatile at times, seemed withdrawn, and he stopped going to school at the end of his senior year. He lost interest in a lot of things he loved. I couldn't figure out what was going on. I searched his room, but never found substance. I thought he was just struggling like many teens do. But after high school, the signs grew clearer. He lost his job, stopped caring for himself. And one night I found a little baggie of blue pills. I took them to the ER where I work, and that's when I learned it was fentanyl. I had never heard about fentanyl as a recreational drug. So as a parent, when your child is actively using fentanyl, it is paralyzing. The fear consumes you. The sleepless nights are unimaginable. Your mind tortures you with scenarios of where they are they alive? This turmoil went on till about 2019. We eventually gave him an ultimatum that he had to get help or he couldn't live at home. He went to treatment many, many times, so many I lost count. At first, he would stay a few days and he would leave, and my heart would be broken. Out of desperation, I would bribe him Air Jordans, jackets, and shamefully, even drugs, just to get him through the doors of treatment. That's what desperation does to a parent when all you want to do is save your child. I remember sitting in the car with him one day in our driveway, the windows shut, not a human anywhere. And I said to him, sometimes I think fentanyl is more important than your family and your friends. And he just snapped back, shut up. The neighbors are going to hear you. That's when I knew the shame was just unbearable. And I've learned that since this is true for many who struggle with substance use disorder. There were terrifying moments too. One night, the police found him lying in the street, thinking that he was drunk. I had to beg them to call EMS because I said he's a fentanyl user. They took him to the same hospital I worked at. One of my friends was his nurse. She assured me he was stable, okay, to get some sleep and we'll figure out a solution in the morning. But what she didn't know is he had pills in his pocket. And that night he went to the bathroom and used, and he coded right there. If he hadn't already been in the hospital, I'm sure I would have lost him that night. After that night, there were also glimmers of hope. After that close call, he began to take recovery more seriously. He completed a 60-day program and decided to start fresh, moving to Colorado and going into sober living. He got a job, he made supportive friends, he had over 6 months of sobriety, and then winter came to Colorado and he decided he wanted to move back to California. My mother's instinct told me it was not the right move, but he insisted. And, he said, Mom, if I wanted to use, I could use in Colorado too. He found a sober house in Long Beach, a job at FedEx. He was excited to live at the beach. He had lots of plans. So he came home. His dad picked him up from the airport. We had family dinner. His friends came over. We were all so happy to see him healthy, and he just looked fantastic. The next day, we just did normal things, and we talked about handling errands. The following day, traffic tickets, things like that, to get him to where he's going to need to be eventually. And I remember thinking, I have my kid back. I can finally sleep through the night. The nightmare is over. And we talked more. And that night he said, I'm going to get my clothes ready and go to bed. And I love you, Mom. And those were the last words I ever heard him say. The next morning, I noticed he wasn't up. And I found him in his room, and he was already gone. Detectives later told me they did find fentanyl near his body. Losing him that way after we came so close and he worked so hard was the worst day of my life. And the grief has been pretty overwhelming. Grief comes in waves. That's what they say, right? But I think the actor Tyler Perry summed it up perfectly. He said, grief is a very living thing. It visits at random. You can't schedule it. You can't work it away. You can't drink it away. You can't book yourself like crazy to avoid it. Grief will wait for you to finish. So when it shows up, however it shows up, let it. And for me, I think grief is all the love in the world I still have for my son, Garrett, but it has nowhere to go. There are many misconceptions about addiction. After Garrett had passed, somebody said to me, didn't you go to rehab? As if treatment is a cure. What they don't understand that addiction is not a choice. To see your child cry because they can't stop is to witness the truth behind these misconceptions. Addiction is not about coming from a bad family, coming from poverty, or a lack of values. It is a disease, and the shame and the stigma surrounding it only make recovery harder. Shame fuels the substance use, and it's one of the biggest barriers to them seeking treatment. Looking back, there were signs I missed. His withdrawal from things he loved, his decline in his self-care, the chaos in his room, but I didn't know what fentanyl was then. And I also realized I probably enabled him for too long out of fear of losing him. But that's why I'm here today speaking out. I want him to remember who he was, not just for his addiction. He had a huge heart. He made people laugh. He welcomed others, even when he was struggling himself. In treatment, he comforted a girl, and she told me later that he made her feel accepted. And today she's 1 year sober, and that's the impact he had. But we also need change. Too often, Garrett was ready to get help. He would call, find a resource, call the treatment center, and they would say, well, call back in 2 days for an interview. In 3 days, we'll do a psych interview. And by then, the window had closed. And so when somebody says, I'm ready, we need to be ready too. I was lucky to find support early through Hazelton Betty Ford's program, the Daily Pledge. They have family programs that taught me boundaries, gave me a community, helped me cope, because families need support just as much as our loved ones do. You know, we don't send diabetics away in shame. We give them care, education, resources, and it should be the same with addiction. When Garrett died, I received an outpouring of love from his recovery community, and many of them are thriving in his honor, and that gives me so much hope. So, my message today is this: that addiction is a disease, it's not a moral failing. And the people that are struggling with it are somebody's child, somebody's parent, somebody's friend. Their lives have value. They deserve dignity, compassion, and support, not judgment. I know I've said this before, but Garrett had a huge heart. He wanted everyone to feel loved and included, and that's how I want to honor him, by reminding us all to see the humanity in people who struggle and to love them anyway. Thank you for letting me share my story.
Thank you so much for sharing, Celia. Our hearts go out to you, and also it is really incredible the strength that you bring and the awareness that you bring. It's really courageous of you to, be able to turn this turmoil into activism to help others who are maybe, in the same struggle. So thank you so much. I invite the audience to let us know if you have any questions. I see lots of appreciation and words of encouragement in the chat. You guys are such an amazing audience, so thank you for that. Um, and so if you have questions for Celia, please let us know. You are encouraged to come off mute or put it in the chat.
Thank you all for your good thoughts and listening. The support program I found for the family was through Hazelton Betty Ford, which is actually the first place that Garrett ever went for treatment. You don't have to have, your loved one does not have to be a patient there. You don't have to be affiliated. You can just log on. It's called the Daily Pledge. They have workshops for setting boundaries, workshop for living with addictions. They have support groups where people can share their stories and you know exactly what they're talking about. It's a fantastic program, and that's thedailypledge.org. You're welcome.
All right. So one thing I do want to share on behalf of Celia is that she would like to be able to really share her story with more people and help reach a wider audience of people who can benefit from hearing a mother's perspective of what it's like to parent a child, even an adult child who is struggling with substance use disorder, and one who has passed from an opioid overdose. So Celia is really trying to turn her grief into something beautiful to remember her son. And so we will drop her contact information in the chat, and anyone who wants to reach out to Celia and talk more and maybe discuss having her share her story in another avenue, please feel free to reach out to Celia.
Available. And I didn't mention, but my son was 25 years old. But thank you guys again for giving me this opportunity.
Yeah, we really appreciate you sharing, Celia. And again, I can't say enough how how heartbreaking your story is, but also the immense appreciation for you turning your grief into something really beautiful.
Thank you.
Okay, so our next speaker is Jerod Nielsen, who is a person with lived experience and is going to share his perspective of opioid use disorder and recovery. So go ahead, Jerod.
Hello, thank you. And that was a powerful story by Celia. One thing that I kind of I don't know, to share is the person that we are or were on our addiction is not who we wanted to be. Um, Sometimes people sit there and say the person never changes, or and they could kind of put a bad stigma on people that use substances or fentanyl or opioids in particular. Um, and sometimes I agree with that, like people don't change because I believe as an addict, we're still the person we were before. It's just the things we choose to do when we do drugs. The drugs bring out our negative behaviors, negative actions, negative thinking. And it's not really until we quit and we have sobriety in us that we become who we were originally. So yeah, so I just thought I'd share that. But my name is Jerod. I'm a substance use navigator at Torrance Memorial Medical Center in the Los Angeles area. And a little bit of background about me, kind of how I got into this field. It kind of goes back to when I was 18. I got into a bad motorcycle accident, and the doctors put me on opioids, on Vicodin, and started giving me that for a few months. And then one day, the doctor just said, "There's no more refills." And there was nothing they offered me, no support, didn't even mention anything about treatment, never crossed my mind. All I know is after the first day of running out, I started to feel withdrawals, started to feel the pain. Well, I knew that I needed something, and I knew somebody that had them, and I went to them, and they gave me some Vicodin, and I took it, and I started taking that, and then I ended up started buying them off of that person regularly, and then the Vicodin turned into um, stronger to Norcos, and then that turned into Percocet, and that turned into methadone pills, and I was getting them all illegally. And then I was on methadone for probably about 10 years or a little less. And towards the end of that 10 years, my life started to kind of really fall apart. I would go to treatment center, and I would end up just walking out after a few days when the withdrawals would get so intense that I felt like the only thing I could do is to use them again. So I would leave and I would kind of start that. I was doing that process for a couple of years. Until my family kind of got fed up, and I was kind of fed up with trying treatment center after treatment center. And the person I used to get pills from was a father. He had two kids that were around my age. One sold meth, and the other one did meth. I went over there to buy some pills. They were out. And he told me, "Hey, just why don't you try some meth to kind of get onto that?" And I was like, "Nah, I'll never do that stuff." And then I went over there the next day. I was hurting really bad, withdrawing. And he's like, "Come on, just try it, man. You'll do it for like a week. And then you just kind of sleep for a couple of days and your withdrawals will be gone. You're good to go." And I did it. I tried it. So that turned me into a meth addiction for about a year and a half until I found myself in jail. I went into after jail, I went straight to like this sober living. I did good for 10 months. And then that was when just happened to have a bad day. And one of the leaders of the house offered me heroin. So I started doing heroin. Started doing that for a few months. My life started kind of falling more apart than it already was. And then I realized, hey, I can't do this anymore. I can't have my life go back to the way it was. So I want to quit. Well, I tried quitting that. felt the withdrawals of the heroin. So I ended up getting a little bit of meth to deal with the withdrawals. And that started a meth and a heroin addiction together. And that went on for a while. And I started to lose everything around me, my relationships, my job, my housing. I became homeless for a little while, living out of my car. I lost my car until I ended up finding myself behind a prison cell with a 12-year sentence for stuff that I was getting into while I was in my addiction. And that was kind of when I found myself in that cell was the turning point for me. That I realized I was sick and tired of being sick and tired. I had a daughter at that time that was 7. And my addiction was taking me out of her presence, and I just kind of broke down, and that was when I made the decision to quit. And since then, I haven't touched it. It's been since February of 2016. I've been sober for, but which all that kind of leads to kind of why I support MAT services, why I think it's so needed and such a powerful tool in California Bridge and places that offer it in the Sun, is because I learned that if I was offered or if there was any kind of medication to help me get off of the opioids, I could have avoided a lot of what I went through. But I'm thankful that I still have my life, because there's a lot of people that don't, that get stuck in the addiction of opioids, and don't get that chance to recover from it and be the person that they were before and that they're meant to be. So I totally, like, I love buprenorphine, I love Suboxone, I love that it offers people a chance to find ultimate sobriety in the end. Because I've seen before this job, I've only been a son for going on 3 months now, but I was a rapid intervention counselor at a treatment center. And I would have a lot of people come in with opioid addictions and with every part of their life falling apart, homeless, divorced, lost their kids. And one person particularly, I seen her. She had lost her baby. Actually, she was going through a day depression, gave her baby up for surrender, and ended up getting in. We referred her to OTP for MAT services. She got on buprenorphine, and I watched over a 6 month period of time her life become manageable to where she ended up getting her child back. And I see that MAT services and especially mixed with treatment, can help people manage their lives correctly, because there is a lot of stigma around MAT medications that you're just trading in one drug for another. And here, and I'm sure a lot of other sons will find it kind of complicated that sometimes you'll come across a doctor that is not willing to prescribe buprenorphine to a patient that is very much needed, because they don't either. Well, they're not that educated in it. They don't believe in it. They believe in abstinence and 12-step programs. And yeah, I'm so sorry. So, and then sorry, I kind of lost my train of thought. But yeah, so I believe that, what we do as sons and helping people to get on medications that can help them prevent and they need to be, is a very important thing that we do. Sorry, guys.
That's okay, Jerod. Thank you and congratulations on your recovery time. 2016 is pretty amazing. All the way to now, 2025 and beyond. Thank you so much for sharing with us your story, and also for being an advocate of Matt. We love that. So again, I invite the audience to let us know what questions you have for Jerod. Again, there are some words of encouragement for you there. But what questions are coming up? What do you guys want to know? What do you want to ask him? Oh, that is so right. So Renee in the chat is saying 1 day at a time. Absolutely.
Yes.
And I do want to also add, thank you for sharing the patient story as well. Because that is something that is always really compelling and really makes a difference for a lot of people who are wanting to kind of go more towards the empathetic side of things. Hearing a compelling patient story can make such a huge difference.
Yeah, it does. And it's sometimes it like even, of course, not all our patients or clients will stick with the treatment or will stick with like in a perfect world, they would get on the buprenorphine or get on or go into treatment or decide just to quit. But you know, relapses do happen and things do happen. But even as like a counselor or an individual that may have, but we see one person's story that work out the way it's meant to be, it's like it just shows you that sometimes we can make a difference if we care and we kind of meet the patient where they're at. And because one person could be addicted to fentanyl and so can the next person, but their road to recovery or how they choose to be treatment could be completely different. But the goal in the end is the same. So it's like being able to kind of do that and help them. It like really is humbles you and it teaches you and I'm just glad that I'm able to share my story today and kind of and share that with patients and be able to help in any little way I can.
Yeah, absolutely. Thank you so much. Okay, so there is a question in the chat that somebody was curious maybe what other medications for addiction treatment you might have considered.
Well, the Suboxone definitely, and me personally, I can't sit there and say Suboxone worked from personal experience because I was never given the chance to take any of that. But Suboxone is definitely it. Buprenorphine, I like buprenorphine, but I like how Suboxone has that little added, how it has the naloxone, and it's like an added discipline for you.
Oh, so
Because
you're
sometimes as addicts, oh, sorry, I thought the question like was what medications would I have taken?
yeah, yeah, no, no, that's perfect. I was just trying to uh I guess confirm. So when you're saying buprenorphine, you mean the mono product versus Suboxone, which is the buprenorphine with the
With
naloxone.
naloxone, yes.
Okay,
Because
okay,
in here we do both. So I mean, we do just pure buprenorphine, and then we do pure Suboxone. But we kind of determine if the person seems at risk to use still, then it'll probably be more of the Suboxone versus the pure buprenorphine. I mean, that's kind of something that's kind of more started a little after the Suboxone maybe and see how they manage it.
okay, perfect. Well, thank you so much, Jerod. I really appreciate your time.
Welcome. Thank you.
And everyone in the chat, feel free to reach out to Jerod in the chat as well. All right, so moving forward to the next part of our webinar, which really ties in some of what we're kind of getting at here with the two stories that we've had from Celia and from Jerod, both really great points of what happens kind of after a substance use addiction starts or substance use disorder starts, or once it's like, full blown into the thick of it. Um, and so what we want to talk about is more of the process before that. So prevention and prevention can still include periodic or episodic substance use. And we want to be able to kind of provide that assistance and information and education before it gets worse, right? Before it gets to the point that there's no turning back. So we're starting with some prevention education tips. And so this is not necessarily for the patient, but for you, for people who are advocates, for those of you who are engaging with people who use drugs. This information is for you to take this and go out and do what you can in your communities to educate and to help reduce some of those overdoses and help save more lives, as many of you already are. So when we're talking about prevention education tips, it's really important to know your facts. So prepare your information beforehand, before you plan to educate on opioid overdose prevention and awareness. And so decide on what types of information you should gather. So, stats would be a really great thing to start with. Stats make a huge difference, especially for data-driven people. You have those that are going to be more need a compelling, empathetic story, and then you're going to have those who are more data-driven. Um, so have statistics. So find and cite local statistics and statewide statistics. So especially those overdose rates are going to be really useful in prevention education. And then have some talking points available to show the benefits of naloxone distribution and what a difference it makes in your community and statewide and even nationwide if that sounds good to you. So emphasizing um, the how naloxone distribution saves lives. We have a lot of information on our website at cabridge.org. As an example here, there's we state on our website in all of our information, it has cited resources as well. But we state an estimated 16% of naloxone kits distributed lead to a life saved. So you can use that 16% to estimate how many kits you've distributed or your community has distributed and kind of do a little bit of math there to give an estimation of how many lives saved that looks like. Sometimes that can be very compelling. Um, Again, sharing a personal story. I've mentioned this a couple of times so far this morning, but sharing a compelling story really does make a difference, as you've heard from Celia's story and from Jerod's story. You have your own stories as well from your own lived experience and from patients and maybe family members. So share those stories. Jerod shared a story of a patient who was able to have family reunification with their child after getting into treatment. Those are really great, compelling stories, especially when you go back to let the provider who maybe was on the fence um, or who helped and provided a prescription for this patient, go back and let them know how it turned out. You Also don't be afraid. So you might encounter some misinformation. You're going to need to combat that misinformation about opioids and about naloxone. So don't be afraid to do that. Be aware of what some of that misinformation is in your community. And honestly, like there are some pretty common things, such as one that Jerod shared that, isn't that just trading one medication for another? Maybe, you know, but if one is less harmful, why not? If one saves lives, why not? Um, so be prepared. To hear some of those questions, and then be prepared to provide the correct information. Um, so uh, let's see. Also, something that I do want to share is one of the things that I used to hear all the time is that teens and children cannot have naloxone. But there was some recent legislation changed, I want to say a couple of years ago, where elementary, middle schools are required. It's the law now that they have naloxone on campus and that at least two people are trained in utilizing naloxone. And DHCS has actually said that there is no age limitation on who can have and possess and use naloxone. So that's very important on, um, being able to just dispel that misinformation and give correct information. Um, so when you are doing prevention education, you'll want to share, so create and share educational materials. You want something tangible that that people can take with them. Sometimes maybe it's noisy and they can't quite hear everything that you're saying, or because if it's a big pop-up table event and there's a bunch of tables, they're hearing so much information, they're maybe not going to remember it all. So if you give them something that they can take with them, something like a flyer or a fact sheet, it allows them to review that material later. And you want this tangible item to have some of the information we just talked about, right? So you wanted to have maybe some statistics and some education on what overdose looks like, and what withdrawals maybe look like, where they can access naloxone for free. Um, and Also creating presentations, which I'll talk a little bit more about in a minute. So as an example, this is a flyer, which is in Spanish, available on our website, amongst other languages. But so this is a flyer that you can use to distribute. It is a 2-page flyer. The first page gives you more detailed information on signs of an opioid overdose, and kind of when and how you would use this naloxone. And then the second page is just a really simple kind of infographic along with the instructions. You also have inside of the naloxone kits instructions on how to use it. I know they updated the boxes, but I used to like the old box where it had that like flip open panel that had the 1, 2, 3 pictures. To me, that was like super simple and easy as long as it restuck afterwards. Um, but the new boxes still have the information. Or you can give out a flyer. Give out a flyer, let people know. Pictures, stuff with pictures and color, grab attention. So keep that in mind when you're creating educational material. Uh, And then this is an example fact sheet. This is from the World Health Organization, from their X account, previously known as Twitter. So this one again has some pictures in it, has some various different colors. Excuse me. Really shouts out what the risk factors are for opioid overdose. So you can use any of the publicly available information, and you can use it just as it is, or you can integrate it into something that you're creating, so long as you cite the source. Don't forget that, which we've cited in this website or on the slide. And then for a slideshow presentation, if you have an opportunity to give a presentation and to share information in person or virtually to a group of people, fantastic. That is amazing. It shows the work that you're doing to to let people know who you are and what you do, and the importance of this work is really paying off, because they're inviting you to share more information. So when you do that, you'll want to make sure to include, again, statistics and information, include data that is relevant to your community and to your state. So one really super beneficial way of doing that is with the California Overdose Surveillance Dashboard. So here you can see kind of, I think it's the top 10 or 7. 10. We'll say top 10. I quickly counted them. But so this is just like the top 10 counties of the highest overdose rates. And some people might look at some of those numbers and think like, well, that's really not very high, but these are individual lives. For instance, Kern County, 321 overdoses in that time period in 2023. That number in comparison to Los Angeles maybe doesn't seem like that much, but when you think about, this is somebody's child, this is somebody's parent, this is somebody's friend, this is somebody's sibling, this is somebody's someone. Those are a lot. That's a lot. 321 is a lot. 10 is a lot. So let's do what we can to, spread as much prevention education as we can and naloxone as we can in our communities to help reduce these numbers. One of the things that are very popular to do, especially around overdose awareness and International Overdose Awareness Month, is community events. So I mentioned earlier about like, pop-up table events and things like that. There's a lot of community events happening. Get involved in one in your community. They're usually pretty easy to find out about, especially if you're connected with your county mental health or substance use disorder divisions. But I want to just give a shout out to everyone from last year. Last year we did a naloxone distribution challenge for all of our navigators to distribute at least 100 kits in the month of August. And we surpassed that. It was truly amazing. There were so many innovative ways that our navigators were able to distribute kits. And so last year, collectively, navigators were able to um, distribute more than 8,500 kits, which is super, super amazing. Think about how many lives that saved. And so we have this brief video to share in celebration. We featured it sometime last year, but I just want to share it again because it really is super amazing. And I think everyone should see it again. No, wasn't that amazing? So the challenge continues this year. It is our second annual naloxone distribution challenge. And it isn't just for navigators and community health workers, it's for all of you in our audience and all of you attending. wherever you work, whatever organization you represent, we challenge you as well. Send us your pictures to mentors@cabridge.org. Let us know how many kits you've distributed this month, and we hope to be able to add you to our next video. There are a lot of resources to put together the information that I just talked about as far as fact sheets and flyers and presentations and whatnot. And just to educate yourself as well, so that when you're talking about overdose prevention, you have some good information to give. So we have the guide to naloxone distribution on our website, which is not only filled with templates to order your own naloxone, but it really is filled with some really great information on the importance of it. The Spanish flyer I showed earlier, how to use naloxone to reverse an overdose, is also available on our website. And again, I'll remind you that it is available in numerous languages, including English and Tagalog and Spanish and so many others, Chinese. I think it's like whatever the top translated languages are. And then there's a lot of external resources that you can utilize to access information, such as the DHCS naloxone distribution project FAQ. So if you have questions about it, especially when you're trying to arm yourself to dispel myths, you can get information straight from the source, straight from DHCS, which is state, and read their FAQs and then educate yourself so that you can pass that education along. You can become an official naloxone trainer with certificate and all. There is a $10 fee for their certificate. We do not promote them or sponsor them or anything. Just throwing that out there. That is an option for you guys. There are training modules available on the National Harm Reduction Coalition. And there are a number of really great flyers and infographics and just information in general on their website. National Harm Reduction has been around doing this work for a really long time, and they are just a wealth of information. And then you have CDPH has some information for youth. So for those of you who are encountering youth, go ahead and check out their information. And then we have the International Overdose Awareness website, where you can get marketing packets, you can get swag from them, you can get all kinds of information, and you can find events happening in your area. I looked it up the last week, I think, and because I'm in Kern County and there are events in Kern County on their website, I thought, like, for sure they're not going to know anything about Kern County, right? Because like we're not as big as like LA and San Francisco and Sacramento, population wise. But no, they had stuff, and I was like really pleasantly surprised. So don't count yourself out. Take a look at that website. And if there's not an event you can attend, feel free to do something yourself. Feel free to get involved in one way or another. Create something. We believe in you. And so I'm going to go through this really quickly because I realize that now I'm losing time. So ways that you can increase your outreach efforts are to visit places you haven't visited before. One of the ways that our navigators were able to increase or boost naloxone distribution last year was visiting gas stations, bars, and clubs. But there are a number of other ones that you can visit and just talk to them and say, like, hey, can I leave some of this here, some of this naloxone, or some of these flyers? And that's one kind of sort of passive way of increasing education and preventing future overdose deaths. So I challenge each of you not only to join our naloxone distribution challenge, but consider what is one thing that you can do to get involved. And so you can go ahead and drop that in the chat. Let us know maybe what ideas have come up during this webinar, or things that you've already been planning months in advance, because sometimes we know big events take a long time to plan. But let us know, what is one thing that you can do to get involved in your community to reduce overdose deaths. And while you're dropping that in the chat, I would like to point out that we have a knowledge check that will be available to you in the post-event email, where you'll get a copy of all the slides. You can access all of our resources again on our website. There's a QR code here for you, or you can just go to cabridge.org. We have a number of other trainings available, along with CHW certification training on our CA Bridge Academy. You can also share this information with your clinicians, nurses, whoever it is, peer support specialists. Share this information far and wide. It is free, and they are CEUs and CMEs that are available. Contact us again, mentors at cabridge.org. And we really appreciate, this is myself and my colleague Chaya. We really appreciate you joining us today. Thank you so much for giving us your time. Thank you, Celia, for sharing your story. Thank you, Jerod, for sharing your story. I appreciate all of the work that everyone here does, and I encourage you to go forth and get involved in your community to help reduce those overdose deaths through prevention and education. So thank you again for joining us, and have a great rest of your Thursday. Bye.